Hello, everyone, and welcome to the first NorCal Symposium on Climate and Pandemic Resilience in Healthcare, co-hosted by Stanford Medicine and the University of California, San Francisco. My name is Raj Fadadu. I'm a public health graduate student at UC Berkeley, a medical student at the UCSF Joint Medical Program, and one of the many student leaders for the symposium. I'm very excited to convene this event, which is inspired by the critical need to address climate change and COVID-19, which are both pressing contemporary pandemics. For the symposium, we'll begin with opening remarks, followed by 3 sessions with 2 concurrent subgroups during each, and we'll regroup at the end for a panel with healthcare executives. The symposium is grounded in 4 main themes: mitigation, resilience, community, and equity. Toward that end, we must acknowledge that racism, police brutality, and other forms of systemic oppression affront our common humanity. Our systems continue to fail at delivering justice and safeguarding health, and this is a truly difficult time. Racism toward Black and Brown communities includes environmental injustices, such as disproportionate health impacts from air pollution, extreme heat, and wildfires. These communities are necessary to center and partner with in order to achieve a healthy, sustainable future for everyone. In addition, although this is a virtual event, we would like to convey a land acknowledgement that the UCSF and Stanford campuses sit on the ancestral lands of the Ramaytush and Muwekma Ohlone tribes, respectively. Consistent with our values of community and diversity, we affirm Indigenous sovereignty and support building solidarity and kinship with the Native people. Climate change magnifies the relevance of Indigenous practices for ecosystem and land management and collaborative partnerships across diverse communities. The escalation of climate change contributes to the increasing frequency and severity in extreme weather events, such as the wildfires currently devastating the Western United States. These events encompass one of the many mechanisms you will hear about today by which climate change negatively impacts both human health and the ability to deliver necessary health care. The COVID-19 pandemic has further exposed cracks in healthcare systems, highlighting their inability to adapt and provide the resources necessary for timely, appropriate, and equitable care. Throughout today's symposium, please listen and engage with an open mind and heart. You'll hear a multidisciplinary array of perspectives on the complexities underlying the climate and COVID-19 crises and the ways in which they overlap. By the end, we hope that these perspectives inspire you to take action through partnerships across disciplines in order to find solutions to problems that may seem intractable. As students, healthcare professionals, and community members, we must be committed to improving the health of our communities and the planet. The movement depends on us, and as more voices join in, our voices grow so loud that others cannot ignore hearing our resounding ask for a resilient and sustainable planet for this and future generations. I have faith that by standing in solidarity and support together, we will be equipped to transform our systems and institutions to become more sustainable through enacting practices and policies that bolster environmental stewardship, champion equity through unrooting systemic oppression, and develop resilience via strategic goals and community partnerships. Now, I know this is all a big ask, and it's time for all of us to get to work. To get us started today, I'd like to introduce the first of our esteemed speakers, Paul King, President and CEO of Stanford Children's Health. He has a distinguished career of more than 30 years as a healthcare executive across multiple academic medical centers. He is committed to advancing Stanford Medicine's vision of precision health through innovating the patient care experience in pediatrics research. His welcome address will be followed by a talk by our keynote speaker, Dr. Cheryl Holder. In September 2009, she joined Florida International University's Herbert Wertheim College of Medicine as faculty. She has dedicated her medical career to serving underserved populations, and her teaching focuses on the social determinants of health, diversity in health professions, and the health effects of climate change. She is also co-chair of Florida Clinicians for Climate Action and well known for her TED Talk on climate change, health, and poverty. With that, I'll now pass it off to our first speaker, Stanford Children's Health's President and CEO, Mr. Paul King.
Thank you, Raj, for that. You can hear me okay? Just
Yes.
Confirmation. Thank you very much. Thank you for inviting me here this morning. Healthcare plays an essential role in the COVID-19 pandemic, climate change, and in ensuring equitable health outcomes. All these appear to be three separate issues, but actually they're intertwined. We see a disproportionate number of deaths in our Black, Latinx, and Indigenous populations due to structural racism. Just as these populations are bearing the disproportionate impact of the pandemic, they will also bear the disproportionate impact of climate change. Healthcare systems have been stressed as never before to test, treat, and save lives due to COVID-19. Healthcare systems are facing increasing stress and disruption due to climate change as well, which will only worsen if we fail to act. Areas with higher pollution due to fossil fuel use are often in communities of color. Exposure to pollution is an independent risk factor for morbidity due to COVID-19. In the Bay Area, wildfires and heat waves driven by climate change cause us increased hospitalization and disruptions to care. Children are uniquely vulnerable to climate change from room to tomb. Children and infants in particular will be the most susceptible to undernutrition with rising food insecurity due to climate change. Over 90% of kids in the world are exposed to levels of pollution due to fossil fuels above WHO recommendations, placing them at higher risk for pneumonia, asthma, and chronic obstructive pulmonary disease. The healthcare industry also contributes to climate change. We produce 10% of our nation's carbon emissions. Healthcare must play a role in helping to achieve sustainability and meeting emissions targets to reduce the impact of climate change. To effectively answer these crises will require placing resilience, mitigation, and equity at the core of our efforts. Resilience. We need to build our healthcare systems to minimize our carbon footprint and reduce resource use. To do so means we would be less dependent when systems are overwhelmed during times of high stress or disaster. Mitigation. We need to decrease the healthcare sector's contribution to climate change by decreasing our emissions. To do so would help to get closer to the goal of net zero emissions to avert the worst climate scenarios. Equity. We need to work to ensure our healthcare systems dismantle structural racism and work in concert with our community partners. To do so would better ensure equitable care and help reduce the disproportionate impact placed on Black, Latinx, and Indigenous populations. I am grateful to the health profession students at Stanford and UCSF for leading this effort, and we are grateful for all of you who've joined us this morning as we work together to build healthcare systems that are equitable and resilient in the face of these unprecedented crises. Thank you and have a good day.
Good morning, West Coast attendees, and good afternoon, East Coast attendees. I'm Dr. Cheryl Holder, and I must thank Mr. King for such a good lead-in and explanation in stating our cause. I also have to thank Lisa Patel and the other organizers from Stanford University Medical School and UCSF for inviting me to speak at this NorCal Symposium. I am really glad to do my part to help us achieve our mutual goals of empowering health professionals and students to learn as much as they can about the pandemic, climate change, health inequity, and to be the catalyst for change. And change we must. This year, 2020, what a year. We learned the truest threat to our stability as a species is not simply the existence of a deadly virus, but rather the gross societal inequities it exposed. and whose harms were exacerbated by a disrespect of science, mixed messages, and an inability of our leaders to work together. Unfortunately, as a clinician working on the front lines of poverty, I have to admit, I was not surprised. In many respects, the outcomes were inevitable. However, the truth is, it did not have to be this way. But that's not what this talk is about. This talk isn't about looking back and outlining step by step all the wrongs. Rather, what I want to do is to share some of the stories of my patients. These are people who live the toughest lives with dignity. I want to share the stories with you because you're healthcare professionals, you're doctors, you hear stories. And because these stories and these patients show us the path forward. These stories are important because we are in the midst of a truly existential threat. And if we don't act now, within the next few generations, life as we know it will be unrecognizable. I don't want that moment to come, and I don't want a future physician to one day say, it did not have to be this way. Of course, I'm talking about climate change. And just like the coronavirus and the police, it is killing Black and brown people right now, and at rates higher than everyone else. First slide. The question is, as always, why? Context matter. We know that all human lives are affected by the conditions under which we are born, grow, live, and age. The school we attend as kids, the parks we play in, the places we worship, and the jobs we get are all shaped by the systems and policies that govern our access to resources, money, and power. The social determinants of health. Next slide. As you can see on this slide, next slide. As you can see on this slide, genes and clinical care account for only 20% of our ill health. 80% is determined by societal conditions. All data shows that the wealthier you are, the healthier you are. And my patients live that truth. Next. So let me start with Anime. Miss Anime, she was one of my more adherent patients, and she walked in for medication refill. She was a 64-year-old Black woman, non-smoker, and she lived in this old part of Opelika, Florida, in an old house that she bought with her long-standing wages that she got in her low-level clerical job with the Miami-Dade County. And she had high blood pressure, diabetes, high cholesterol, asthma, COPD, and she was always on her medicines. So when she walked in and asked me for that medication refill, I was filling it out. And as we know in primary care, the most important thing happens right at the end of that visit. And I was finishing up with her, she slips me this form. And this form is a Florida Power and Light form that allows physicians to document serious medical conditions that we would then allow them to give us, give the patients a break on their bill. So I was like, well, Ms. Adame, there's really no reason based on this form. You're not in any machines. You don't need anything to help you breathe. What's going on? And this was in 2016. And Ms. Anime says, it has been so hot that I have to use my air conditioner day and night. And I couldn't breathe. Between paying for the extra light and buying more refills, I didn't have enough money to pay. Then the next patient, Jorge, where that wasn't Anime in the picture, but she looked so much like her. This is Jorge. He's my real patient. And he is an undocumented worker who sells fruits. He packages oranges. He lives in that shed behind the house. And it's one room. And he packages fruits and he sells in the heat. And sometimes he'd come in and his kidneys weren't working so well and be like, Jorge, you've got to rest some bit. You got to stay in, you got to keep hydrated. And he says, Dr. Holder, rain or shine, cold or heat, I have to work. And as his condition deteriorated, I was telling him about the heat and the climate, and he wanted to do something because he knew he was dying. And he participated in this interview. He says, if I could do something to help people to understand what's happening to the heat. And so Jorge talked about it and talked about his life. Next slide. Now, Maria came to me after she had been diagnosed, because she works in a part of Florida. We still have farms, and we have undocumented workers who come in and pick, and in California, you understand. And Zika epidemic was happening about 2 years ago down where we were. And she got bitten while she was pregnant, and she had her baby. This isn't her baby, but her baby was well, but she ended up with postpartum depression. And I was seeing her about 1 year to 2 years later, still dealing with this. Next slide. Sandra Faye Twiggs. I read about Sandra Faye, and I saw on television when the judge says, I'm not here to talk about your breathing treatment. And Sandra Faye was sitting in a wheelchair in front of the judge, letting the judge know, I can't breathe, I'm having problems. Sandra Faye had been arrested after a fight with her daughter over a fan. That April in Fort Lauderdale, where she lived, was incredibly hot. She had no central air, no room air, and they fought over a fan. She was arrested. 3 days later, she went back to her house. She was released from jail. And her family said she coughed and coughed, but she didn't want to go back in. And she died in her bed 3 days later. Next patient. Next. I saw this in the New York Times, how climate migration will reshape America. Millions will be displaced. Where will they go? Next slide. And I saw the pictures of California burning and the anticipation of how much fire and this migration. But for me, I have Madame Marie. Madame Marie is already a climate refugee where I am. Way back in time in Florida, they had Black neighborhoods, because of segregation, were placed next to the railroad tracks. And these railroad tracks, engineering turns out to be the sturdiest, highest ground in South Florida. Miss Madame Marie, she was already in a low-income area that is now being gentrified because all the developers know that where she lives is 10 feet above sea level, and it's now prime property. And she's now homeless. Next slide. This story came from my student. He was an undergrad and he went off to medical school and in Alabama, and a huge tornado came through. And he goes, absolute and total catastrophe. What happened just 5 minutes from me. I bunkered down in my closet with my dog, and the sirens rang outside and throughout the city. To say that I was blessed is an understatement. People are missing, and our authorities fear that they could have literally been swept away from their homes. Worst of all, that it went through the very poor communities. And that is again what we see. He was safe because he was in a sturdy medical school, but the poorest communities in Beauregard, Alabama were hit as their trailer parks and their shanty houses couldn't withstand the tornado. Next slide. What we're seeing here is how the social determinants impact our patients' lives. And as we go through every day, we see this and we see its manifestations. And as Anna Mae in her poor housing and Jorge in the hot streets killing his kidneys, and Madame Marie being forced out of her home, and Maria in her unscreened home and picking in the fields got Zika. And Tammy Faye Twiggs, her apartment should never have been so hot to cause that fight. These disparities are real and are created and driven and maintained by policies. Next slide. For Black people, It goes back to 1619, when the first slaves arrived. And when a policy was developed that supported a political structure to determine that based on the melanin production of humans, those humans would be subjugated to a life of poverty and disparities. And many of those policies continue today. Next slide. Here we look at in Richmond where redlining was shown to leave neighborhoods to be centralized, no green cover, concentrated with concrete, and now melting because they became heat islands and deliberate government policy. Next slide. We heard from Mr. King, and we heard again that Black folks and brown people live in communities that are disproportionately affected by pollution because they are areas of poverty, where they'll place the coal plant, they will place the factories, they'll place the highways. And despite all of that, they spend so much of their money, like my Miss Anime, in trying to pay her bill, and because the AC she ran pretty much escaped through the cracks in her window. Next slide. When it comes to the Latin population, 55% of the Latin people in this world live in the 3 states that are already experiencing serious effects related to climate change. And their employment puts them directly out in the elements, agriculture, manufacturing, and construction. And their exposure to ground level ozone standards are 50% of them are exposed to very high levels. Next slide. And then when we look at income, which comes again from policies over centuries, and I didn't mention the Native American, and I love that Raj brought in the Native American and recognized what has happened to that population. And if you put them in all of this, you see that they are also struggling. 59 cents on the dollar for Blacks and American Indians, 73 cents on the dollar. Systemic policies. Next. So we see again, it is not an accident. This is not a surprise. This is expected. And the incredible sad part also, that the folks that are feeling the disparate effects of this climate are not the ones that are consuming goods and services that are adding to the pollution burden of our world. So how does climate change impact our health? Next slide. I have to teach a little bit about the science, and we encourage you to learn some more about it. This is the atmosphere. When we talk about social determinants, where we live, where we work, we are on planet Earth, our Mother Earth. And that little blue line is what protects us and keeps this planet not too hot, not too cold, just right for human inhabitants. And next slide. What we do to that little part of the atmosphere is what is now driving the greenhouse effects and driving the warming. By all the fossil fuels that we're burning and putting these particles in that atmosphere, that thin layer, think of it like a little fleece blanket. And then we started we decided to make a goose pillow out of it. So every particle goes up, starts blocking the heat that comes down from the sun from going back out. And then we end up with this huge goose blanket around our planet, and it's warming us. And it warms the planet, the ice melts, the particles hurt us, and the sea level rise, and all the extreme weather. Next slide. So we know it is just too much CO2 being trapped and leads too much heat. It's really simple. Next slide. Where are we getting this? Transportation, electricity, industry, agriculture, commercial, residential. We all play a part in this. And these are the things that we are going to have to address if we're going to save our planet. Next slide. So how does it impact us? There are 4 major impact categories. And again, we talked about it directly, from extreme heat. And you've heard my patients like Jorge, air pollution, extreme weather, the tornadoes, the fires, the spread of disease, the vectors, like Marie, disruption of water and food supplies into contaminated water, food, and hunger, malnutrition, and Mr. King talked about it. And one thing, the disruption of our emotional well-being. We often take that for granted, but as each of us go through these traumas repeatedly, from the fires, from the floods, from the hurricanes, from the earth, from all the things that we see, even if we're not directly there, we see it on television and we're constantly being affected. Next slide. And this is a little mnemonic that we devised in our group to help us remember the 8 main ways that we get hurt. So heat illness, exacerbation of heart and lung conditions, asthma, traumatic injuries, water and foodborne illnesses, allergies, vector-borne diseases, and emotional stress. But that's an iceberg, because that's just the tip of the iceberg. As the research continues, we're going to discover more and more ways that climate is impacting our health. Next slide. And as the data is coming in, we're seeing more things like the asthma, we're seeing the death rates when the trees flower weeks earlier, and there's more pollen and there's more ground level ozone. And Mr. King already told you about the children. Next slide. And we talked about the vector-borne diseases. And look what's going on in this map. It's not just Florida that has mosquitoes. Because of the warming climate, the place that they can live and reproduce keeps moving up. And we're going all the way up. And in California that wouldn't have these problems before, in time it will happen. So this is the data is clearly showing that this is an impending doom for more of us. Next slide. Mental health, I put this in because after Puerto Rico, they saw a rise in suicides. And we know that the mental health issues are real from climate change, especially for children. Next slide. With coronavirus, that was even more important when we saw that the populations that had more exposure to pollution, particularly 2.5 matters, were doing worse. And just a small reduction in that showed an increase in their life expectancy from coronavirus. Next slide. And this is incredible. This was recent. And this is from the Dr. Rupa Basu. And they did a whole set of studies and looking at hundreds and thousands of women. And there was a direct impact on heat. And it was definitely clear on Black women. And so we're having environmental issues affecting our children. Now, one thing that's happened with babies with the coronavirus is that for the first time worldwide, we've had a decline in premature births. What happened? Our pollution declined, our mothers went at rest, and we saw a decrease. We've had research for hundreds of years, and we've never been able to decrease the number of premature births than we've had during this time. Next slide. So what are we to do? You've seen the health impacts. You learned how it's done. Physicians, clinicians, we are the trusted messengers. You heard what I talked about, the mixed messages. What was lost and not trusting the science in the coronavirus, we've seen that in climate change. And it's time that we start to do something to make the difference. Gallup studies before the pandemic showed that the most trusted voices were nurses, doctors, pharmacists. We can act. We can do things like changing our curricula, bringing it in now, not wait for the 10 years that curricula change happens, but bring it in now. We've got to remodel medicine to incorporate economic and social justice. It's the social determinants of health. And as clinicians, we have to be loud in letting us know that, no, we cannot continue. Racism cannot continue. Disparities, sexism, homophobism, we've got to stop. And we have got to give the resources as needed to help the population stay well, because that is justice. We got to do more research. We got to make sure we get paid for doing this, because that's how we know the reality is. If we don't get paid, it is very hard to sustain programs, and it is valued So we should be paid to do this. We must prepare our patients for this. It is happening now to my patients. It's happening to those pregnant women. What did you do differently with those pregnant women now that we know that heat is doing this, pollution is doing this? How do we know that she needs to be at rest before 9 months and shouldn't be on her feet right up until she delivers? How do we prepare our patients mentally and physically for the health impacts? And Mr. King already talked about what we need to do in greening our facilities and the responsibility to healthcare, because as we green, we must accept that we must stay and reduce our fossil fuel use. Next slide. Advocate, educate, engage. And there are lots of things you can find, you can search, and you can become involved in as clinicians. Next slide. Florida clinicians, again, mitigating climate change presents unrivaled opportunities for improving public health. Physicians, nurses, and other health professionals, we have a voice. It's time for us to act. Next slide. The truth is, we already have everything we need. Just listen. Listen to your patients. Find the will, do the work, help them, and save ourselves. Thank you.
Lisa, you're muted.
Yeah. Thank you so much, Dr. Holder. That was an amazing presentation. I think we're collecting some questions here, but my first question to you while we're waiting for the questions to come in is, we're in the 2020 political cycle. And what I often hear physicians say is that climate change is very political. When most of us who are engaged in this work look at it very much through a health lens. What would you say to those physicians who say, I don't want to talk about climate change because it feels too political?
I ask them to really look at the facts. Everything is political. All our lives are impacted by the policies. So you cannot escape it. The choice of how you get paid was political. The choice of who you see was political. And if we are here to make an impact in our lives, in saving lives and making the difference, that's why we all went to medical school. I hear it all the time. Then how can we avoid the facts? And that's where I talk about changing the curriculum so physicians understand that the new model of medicine shows that ill health is not determined by all those hundreds of years we spend figuring out the genetic makeup and figuring out what's Krebs cycle and all that. It is important, but that's not what's making us sick. So it means that we can be political, but political does not have to be a negative. Political is advocating for the science. Political is recognizing the facts and standing up for the facts, because that's really what we need. And doing the research, because if something changes, show the evidence for it. But there's no way we can say that climate change is not happening, global warming should not be abated, these fires and extreme weathers, and that our patients are dying because of it. It's like masks. How could masks be political? As clinicians, physicians, it is not political in that sense. What is political is that we have not put in a new paradigm of how we see medicine, that economic and social justice is important, that addressing racism is important, that these are things that keep our people alive.
That to be a good doctor, we can't just treat the body, we have to treat everything outside of it that determines
20% what's causing you sick. So why are we going to just do 20%? Why don't we go for more? I mean, that's what we do in medicine, is to do better. And we've come this far, let's do better. I'm not saying to ignore the 20%, but I'm like, we can do better, because the new evidence that's saying that, and we say all the time, evidence-based medicine, evidence-based medicine. This is what the evidence is showing. How do we translate that medicine and apply it? And then that means that you must tackle these issues.
Here's another question. So we have Dr. Holder, thank you so much for being here. You brought up some possible strategies, mitigation, education. how do you start conversations with your patients and colleagues in a frame that isn't overwhelming or overly negative, but instead empowering?
When I talk with my patients, I ask them, that's right, what questions? And open-ended questions always work. When it's summer, God, how's the heat? How are you handling the heat? And what do you do to stay cool? Mm-hmm. Tell me more. Now, when they don't say, oh, I'm okay, you have AC? Do you have a fan? What do you do? And then you go through the issues. It's the social history being designed in a way that you really go after the key issues that are making you sick. We always ask high blood, cigarettes, drugs, alcohol, which is important. But now we're saying, what is making your patients sick? How are they living? Tell me about your day. I have patients who take the bus. When you're taking the bus, are there any bus benches with covering? What's your route? And now with COVID, how are you staying safe on that bus? Do you have extra gloves? Do you have your mask? Are you using your hand sanitizer? So these are important questions because, again, it's about doing proper medicine. So it's stay open-ended, get to know them. It is tell me about you. Tell me how you're managing this COVID crisis. Tell me how you're handling the heat. How are you paying all your bills? Where's all your bills going?
This next question actually builds from that a little bit, which is you've asked your patients these open-ended questions. You've identified the ways in which they've been vulnerable. The question is, you spoke about how air pollution from fossil fuels and recently for us in California, wildfires is part of what makes us vulnerable. What can we concretely do to help these communities once we've identified how the patients have been made vulnerable?
Unfortunately, that's where policy and voting comes in. So long term, it's going to be policy, voting, minimum. There are things like just a minimum wage, a living wage, so they can then have some power to live in better housing. Short term, we've developed a medical legal partnership where we're looking at forms and letters that we can help our patients write that then alert their landlord to these issues. And then we can also develop we are working with the legal aid group with these letters to help the patients navigate the system to get the resources. Most cities have some dollars for mitigation. So it's really guiding them in that direction. Now it's not a lot. And again, that's where voting and policy comes. How much are you going to put in? New York City just put in a big amount so that they could get air conditioners for some of their communities that didn't have any cooling systems. So their short-term, the long-term goal is for us all to decrease fossil fuel, but the short-term is guiding our patients, just like with the pregnant woman. Yes, she lives on a heat island, but you can tell her she can't leave her house without a water bottle. Mm-hmm. She got to make sure she drinks her fluids. If she sees swelling legs, she got to rest. She just, even with her job, and if it means finding ways on her job to get help. Now, many of our patients got to work, like Jorge. They don't work, they don't get paid, they can't live. And then that's where the long term, our Family Medical Leave Act, our maternity leave, our living wage, these are policy things that we have to drive as a profession because we know that's what's going to save that mother's life. That's what's going to not have a preemie. Because we spend so many millions on the other end in the NICUs. Mm-hmm. Think if we just refunded and spent a little bit differently, we would have fewer babies in the NICU.
Here is a policy level question. So Dr. Holder, what do you see as the role of health insurance plans? So things like Medicaid and supporting any one or more of the areas you've presented.
Well, it's key. And you see one of my act now that I know we've got to have billing and have payment for it. There are right now codes, the Z codes in your ICD-10. And those codes are not sufficient to give you any reimbursements. So the physicians are not going to have the limited time we have. They'll do the history, but then the codes don't capture the seriousness of what's happening. So we do have to revamp how we code. These insurance companies, and you see more, are taking on looking at housing as one of the services that they provide to the community. And I always forget the names, but there's an insurance system in Pennsylvania, and I think Kaiser is, well, I don't know if Kaiser, but there's a small group in South Florida, AIDS Healthcare Foundation, that's looking at getting better housing for their HIV patients. So there are strategies that the providers can do to help the population. But overall, we do need Medicaid expansion so everybody gets access. Some sort of universal care that everyone gets access to care. Because the more we can get in the system, the more we can then help them navigate and prepare them for what's happening. So universal access, definitely. And then some of the smaller programs within. And the health system need to join us. But clinicians have got to speak up. We're on the boards, we send patients to them. We can make a difference.
I think I've heard you answer part of this question, but I'd love to hear your take on it. So it sounds like universal access to healthcare is important. But regarding climate and health disparities, what do you think are the top 1 or 2 priority actions we can take or we should be advocating for to address climate justice as a collective?
Well, now that it's November, if we do not do something about fossil fuel and do something about how we fund climate and fund clean energy and fund energy efficiency, we are going to lose. So our primary thing I see now is voting in people who respect climate science, who understand where we're heading and understand the urgency. Many of the current leadership are now acknowledging the climate issue and acknowledging the need to mitigate. However, that doesn't get us to the urgency because my patients are feeling the effects now and the urgency. If we wait 20 years from now, how many more died? Coronavirus accelerated the death of the population I care for the same reasons. So in 6 months, 200,000. If we wait 20 years, what are we looking at? So the urgency is what I'm looking for in the vote. Who's going to urgently address that? So urgently, we need the policy, we need the support. Secondly, I think we need the clinicians to come on board to start driving the health education, driving the awareness of what's happening to our people, help our patients connect the dots. Now, these are my poor people, but the poor people are just telling us what's going to happen to the rest of us. It's just a matter of time. So if we can use this information to develop systems, then that would be the next step. And then, of course, individual responsibility. There's always that role. What are you doing? How are you educating your friends? How are you educating your family? If you do one thing, cut out meat. In Florida, I'm encouraging folks to buy organic sugar because we burn our fields and that increases the particulate matter of the cane fields. And they burn it many times when the wind is flowing over the poor areas. Organic sugar, which uses green harvesting, doesn't burn. So that's a simple thing you can do. It doesn't impact it, but it starts getting you on the path to recognizing that I'm going to do something every day and I'm going to educate every day and I'm going to vote for policies that support where we're going. We have a narrow window. And so it's urgent that we make that move.
This question is, how do you maintain, you take on a lot, Dr. Holder. So what's your advice to us in terms of maintaining your own emotional well-being when facing climate change every day?
Well, I said it in my thing, my patients, they live tough lives and they do it with dignity. And when they come in, they are like, so how are you, Dr. Holder? I hope you're getting some rest. My life is so much easier than what they do every day. And they can take that time to express their care and concern for me. And like Jorge was dying, he took his time and expressed his care for the world. And I'm inspired. So as when I get tired, some patient comes in and says, "Oh, it's okay, Dr. Holder, we got you, we got you." So that's what I have. I have a community that says, they got me. Don't worry about it, we got you.
We have one back to discussing the fossil fuel industry. The audience member asked, is the extraction, production, and consumption of fossil fuel a social determinant of health or an economic one? How can we hold those who have profited by producing the climate crisis accountable for the terrible ongoing harms that are occurring? How can we ensure that the wealth created by the fossil fuel industry is used to solve our collective problems that have resulted from it?
That's policy. That's how you decide your tax structure. That's how you decide what role they'll play. And that's where the vote comes in. So there are many ways. There are folks talk about the carbon tax. Many of the fossil fuel now is pushing to say that they can now store CO2. And they're moving very big into solar, and they're moving into wind, and they're moving into controlling energy, but they want to delay it so they can get to the point of control. So they knew this was happening from 50 years ago. But money talks and voters allow things to happen. So I encourage us to, if we're going to do whatever solution that we find, whether it's carbon tax, whether it's an overall universal income that comes from their resources, if it's to stop bailing them out when they go under, if it's to stop building and subsidizing them, because that's what we do now, then there are many avenues that we can take back the control. But it starts with us being educated. It starts with us not being afraid of being political and saying that we just want what is right for our planet, what is right for our people.
That is a beautiful sentiment. Is there any other last tips or advice that you want to give this healthcare community as we're trying to collectively advocate for our patients and for climate health?
Yeah, I'm just so happy. It's another group that motivates me at my medical school, the younger, they're millennials and Gen Z or whatever the levels are. And I see that excitement and that hope. And they are so much more advanced than I was at that age in understanding all the political structures. They're the first to go out and protest. They're the first to call their congresspeople. They're much more sophisticated in understanding the intersection of social justice, environmental justice, and health. So then they see their role already. So I say stay the course, use that collective energy, talk to your patients, listen, hear their stories, and see how they live their lives despite all the anguish, or despite, even if you're rich, there's stressors there. Everyone's social determinants drives how they live. So as we pay attention to how you live, how you work, how you play, how you love, and bring that together as the inspiration to keep fighting for what is right to save our planet and save ourselves.
Thank you, Dr. Holder. Those are beautiful words. And you've actually set me up perfectly for the next thing we're going to do, which is this entire symposium has really been the work of our wonderful medical students. And we're now going to show their voices. So I'm going to.
Thank you. Thank you. Stay safe, everyone.
Yeah. Apologies, 1 second while I pull this up. All right, so this is a video that was put together by our amazing medical students. This is just to give you guys a sense for our day. We're gonna have 6 sessions offered through the day. And this just gives you a flavor of what each of these sessions is going to be about.
Lisa, we can't hear the audio.
Can you hear audio?
Yes.
Okay.
Hi, my name is Melina Rappazzini, and I am a midwifery student at UCSF who cares about climate change and education reform because I care about my patients' long-term outcomes. As the climate crisis intensifies, it is so important for health students and for postgraduates to learn how to incorporate climate change's associated health effects into our active practice. Unfortunately, today's health education system does not sufficiently teach students about climate change's direct and indirect effects on human health. Furthermore, upon graduation, there's limited support for actively practicing health professionals who want to incorporate a climate change-informed framework into caring for their patients. In the Curriculum and Education Reform subgroup, we're going to be using a case presentation of a patient experiencing a cardiac health crisis during a wildfire. We're going to demonstrate how climate change can seamlessly be integrated into pre-existing curriculum in a manner that goes beyond just giving a few lectures on how bad climate change is. This is going to be followed by an expert interdisciplinary panel comprised of a social worker, an emergency room doctor, a pharmacist, and an actual patient who are going to share their expert opinions on the case and on the management. And then lastly, we're going to break out into two groups of active health professionals and then a group for academics and students who are going to be led to how to develop action items so that they can create real education reform and change in their systems, universities, and organizations. Climate health education is going to foster a new generation of health professionals and students who are going to be equipped with knowledge regarding climate and health, justice, and systems, and be prepared to advocate to improve health and care delivery. I hope that you join us in our session. Thank you.
COVID-19 and climate change are crises that expose deep health inequities. Achieving health equity in the face of these crises will require authentic and effective partnerships between healthcare institutions, community-based organizations, and the most heavily impacted communities. In our breakout group on building community partnerships, we'll hear from 4 leaders of community-based organizations from the Bay Area that are leading the movement to combat climate change or COVID-19 in a way that centers equity and justice. We'll hear from Dr. Sri Shaman Sundar of the HEAL Initiative, a fellowship program that aims to train healthcare professionals to provide care for the resource denied. Dr. Shaman Sundar recently led a solidarity response to Navajo Nation's COVID-19 outbreak. We will hear from Kirsten Meridian, a nurse practitioner at Stanford Children's Hospital and board member of Canopy, a Palo Alto-based urban forestry nonprofit that promotes healthy trees, healthy communities, and shade equity through advocacy, education, and planting trees on the Mid-Peninsula. We will hear from Michelle Pierce, who leads Bayview Hunters Point Community Advocates, a group of longtime residents of the Bayview Hunters Point neighborhood in San Francisco who have championed environmental, health, and social justice for their community. And we will hear from Carrie Ramirez of Youth versus Apocalypse, a youth-led organization based in Oakland that organizes young people for climate justice. We're so excited to learn from their diverse set of experiences, which all converge on the common goal of improving the health and lives of people in communities that are hit first and worst by health crises like COVID-19 and climate change. A key goal for this session is to listen to these leaders describe how their communities are impacted by climate change and COVID-19, and to learn from how they have built on the strengths of these communities. Our goal is to identify pathways towards genuine partnership between healthcare institutions, community-based organizations, and marginalized communities. After a brief summary of local climate and COVID-19 challenges from our student organizers, our speakers will give lightning talks and then participate in a discussion moderated by Dr. Rupa Maria, a physician activist who is a co-founder of the Do No Harm Coalition at UCSF, and who is writing a book on the health impacts of colonialism with Raj Patel called Inflamed: Deep Medicine and the Anatomy of Injustice. We hope you will join us to learn from the deep wisdom of this panel, and that you will come away with new ideas for deepening your engagement and allyship with climate and COVID-19 affected communities.
Hi all, we have an amazing food session lined up for you. We are going to hear from folks from all over NorCal about the ways they are transforming food systems in their institutions and communities, and how you can get involved. First, we will hear from Dr. Daphne Miller, who will give an overview on how food intersects with health, sustainability, and equity on a systems level. Then we'll hear from Chef Santana Diaz, who will speak to UC Davis's Farm to Fork program, and how you can advocate for sustainable change in your own healthcare institution. Finally, we will have 4 lightning talk speakers who will talk about food recovery from healthcare systems, equitable food procurement and building community partnerships, how people are addressing food insecurity in the Bay Area through this pandemic, and how you can educate your patients about sustainable and healthful diets. Please come to our session on September 25th from 2 to 3:15 p.m. You will leave with an action item in hand, and we would love to have you join us.
During the Advocacy for Healthcare Professionals subgroup, we will discuss tangible ways that healthcare workers can advocate for sustainability changes for their patients at the local and national levels. In collaboration with our community partner, the Coalition of Concerned Medical Professionals, or CCMP, we will hear about concrete ways that climate change has especially impacted low-income Bay Area communities. Randall Miller from Physicians for Social Responsibility Bay Area will then share best practices on advocacy. After going over the different types of advocacy, participants will break out into subsessions on legislative advocacy, professional advocacy, or community advocacy. During subsessions, speakers will equip participants with concrete advocacy skills that individuals can utilize after the symposium to promote changes within their communities and nationally. Additionally, each subsession will have action items for participants to complete and give participants the opportunity to provide contact information so that symposium attendees can follow up with one another and exchange advocacy tips and tricks. We are looking forward to seeing you there, and don't forget, one of the best ways you can facilitate change is by voting. So don't forget to register to vote. Thank you.
The World Health Organization declares climate change as the greatest public health threat of the 21st century. Yet the healthcare sector itself emits 10% of all the greenhouse gases in the United States. Through greenhouse gas emissions and landfill waste from countless single-use products, healthcare is harming the very health of those they aim to treat. Additionally, the pandemic has laid bare the fragility of the single-use supply chain for PPE. Using a case-based approach, our speakers will explore proven methods for reducing hospital emissions with a focus on supply chain emissions as well as waste diversion. Dr. Jody Sherman, anesthesiologist and internationally recognized researcher in the emerging field of sustainability in healthcare, will speak on how reusable PPE and medical devices can hit the triple bottom line: good for people, good for the planet, and good for a hospital's bottom line. Gail Lee, UCSF Sustainability Director, will shed light on pioneering projects at UCSF in the areas of energy and water conservation. Dr. Seema Gandhi from UCSF and Dr. Praveen Kalra from Stanford will highlight their own projects in the operating room and how they fostered cross-institutional collaboration to ensure success. Each speaker will highlight key takeaways and stepwise actions for others looking to follow in their footsteps. The session will conclude with a SMART goal setting session where participants will commit to achievable, bold action and be matched with participants with similar goals for a follow-up session. Join us at the Decreasing Healthcare Emissions and Waste subgroup session. Hope to see you there.
Hi everyone, my name is Ashley and I'm from the Disaster Resilience subgroup. This summer, Northern California has witnessed multiple disasters that require urgent action. The COVID-19 pandemic, devastating wildfires, and record-breaking heat waves, to name a few. Each of these disasters has profound public health implications, and they compound each other. Wildfire smoke forces people to stay indoors, where heat waves can make temperatures unbearable. The COVID-19 pandemic has led to a shortage of N95 masks, which are the only masks that can protect outdoor workers from dangerous wildfire smoke. We wanted to host this session in order to highlight cross-cutting solutions that improve disaster resilience across the board. We hope this approach will help us make the best use of limited resources during this tenuous time. For this session, we bring together guest speakers who are disaster resilience experts from academia, the community, as well as California's Department of Public Health, and we are so grateful for their time. Please join us to learn more about their exciting work and how you can help make your community resilient to the interrelated disasters that we face in Northern California and we're likely to continue to face. Thank you.
All right, hopefully you can hear me. Hi there, I am Chelsea Landelin, clinical faculty in the UCSF School of Nursing, chair of the Academic Senate Ad Hoc Committee on Sustainability, and a co-organizer of the symposium on the UCSF side of the house. I hope you've enjoyed the program this morning. Next, it's our pleasure to offer you the opportunity to dive deeper into topics of interest to you. Over the next 3 sessions, you will have 2 options from which to choose. Don't worry, it's hard to go wrong, as I hope you've gathered from the video. Just click on the one you'd like to join right from the Whova agenda. There's typically a main session that you will see near the top of the session page. Some sessions will offer breakout groups mid-session, and you'll receive directions about how to access these. So first, the Community Partnerships for Climate and COVID-19 Resilience session will run alongside the Advocacy for Health Professionals session. We will then break for lunch from 11:35 to 12:30. During lunch, you can check out our community board. Look for the community option on the left side of Whova to find or create a topic that interests you. There you can chat, make plans with others, and more. Those of you who are health profession students can join a special networking hour if you wish. After lunch, both the Disaster Resilience and Education and Curriculum Reform for Climate Change sessions will convene. After that, we'll break, followed by the Sustainable and Resilient Food Systems and Decreasing Healthcare Emissions sessions. Next is a virtual happy hour at 3:15 that offers you the opportunity to meet with any of 8 different incredible organizations working on climate and equity. I strongly suggest visiting these and consider joining one whose work most speaks to you. We'll come back together at 4 p.m. for a star-studded leadership panel that you won't want to miss. We will hear closing remarks from the distinguished Dr. Kari Nadeau to end the day at 5 p.m. Please take any breaks that you need from the screen throughout the day. We don't mind one bit. Let us know if you have questions. if you go to the community section on the Whova, there's an Ask the Organizers Anything topic where you can do that. We'll now take a 15-minute break. Please rejoin us at 11:20 a.m. Thank you.